When people think of cancer surgery, many still imagine large scars, weeks in the hospital, and a painful recovery. But over the last 2 decades, technology has transformed how we operate. Today, GI cancer surgery can be safer, more precise, and less disruptive to daily life than ever before. In this video, I'll walk you through the major technological advancements that changed the way we treat cancers of the stomach, colon, rectum, liver, and other digestive organs. Hello, I'm Dr. Vivek, a GI Onco-Surgeon at SSO Cancer Centre. My focus is on cancers of the digestive system, the stomach, colon, rectum, esophagus, pancreas, and liver. In my practice, I've seen how patients come in fearful of surgery, worried about scars, long recovery, or whether surgery itself is safe. But the truth is, modern surgery is very different from what it used to be. Let's go step by step and explore how new technology has reshaped surgery, from the way we see inside the body to how we cut, join, and even plan recovery. Earlier, cancer surgery often meant a single large incision across the abdomen that gave access, but it also meant more pain, higher infection risk, and a long hospital stay. With laparoscopic surgery, also known as keyhole surgery, we shifted to small cuts and a tiny camera. Instead of opening the whole abdomen, we insert slender instruments to small ports and operate by looking at a screen. This was the first big leap, and it changed patient experience forever. Less pain, smaller scars, quicker recovery, and lower complication rates. If laparoscopy was the leap, robotic surgery has been the refinement, with 3D vision and robotic arms that mimic the human wrist, but with greater freedom of movement. We can operate in extremely narrow spaces like the pelvis with unmatched precision. This is especially useful in rectal cancer surgery, where protecting delicate pelvic nerves is critical for bladder and sexual function. Robotics has allowed us to cure the cancer while preserving quality of life in many more patients. And just to be clear, the robot does not operate on its own. Every single movement comes from the surgeon at the console. Think of it as a magnifying lens, an extra pair of steady hands that extend our own abilities. Traditional laparoscopy shows the inside of the body in 2 dimensions, like watching a flat video. It works, but sometimes depth is harder to judge. Now we have 3D laparoscopy, where surgeons wear special glasses and see the organs in depth and detail. This makes delicate dissection faster and safer, especially when working around small blood vessels or hidden lymph nodes. It's like switching from regular TV to a high-definition 3D. Once you see the difference, you never want to go back. One of the most fascinating tools today is fluorescence imaging. By injecting a safe dye, we can watch the blood flow in real time under a special camera. It tells us instantly if a piece of bowel or stomach has good circulation before we reconnect it, reducing the risk of leaks. It can also highlight hidden tumors or lymph nodes that might otherwise be missed. In other words, it helps us see the invisible during surgery. When operating on the liver, we often deal with tumors deep inside, close to vital blood vessels. Intraoperative ultrasound is like having a live map inside the operating field. It allows us to locate tumors precisely, see their relationship to blood vessels, and remove them safely while preserving as much as healthy liver as possible. It is a perfect example of how imaging and surgery now go hand in hand. Technology has even allowed us to use body's natural openings like the mouth or rectum to remove certain tumors. This is called natural orifice surgery. For selected patients, this means almost no external scars at all. While it's not for everyone, it's a glimpse into where surgery is headed. Less invasive, less visible, more patient-friendly. Even the tools we use to cut and join tissues have advanced. Staplers allow us to connect 2 ends of the bowel in seconds with secure, uniform joints. Energy devices cut and seal blood vessels at the same time, greatly reducing blood loss. These may sound simple, but together they make surgery faster, safer, and more reliable. It's not just about what happens in the operating room. Enhanced recovery after surgery, or ERAS protocols, have changed the way patients heal. Instead of fasting for days, patient can often drink clear liquids right up to a few hours before surgery. Pain is managed with modern techniques that allow early walking. Patients sit up, walk, and even eat soft meals much earlier than before. The result? Shorter hospital stays, fewer complications, and a smoother return to normal life. So when you hear the word cancer surgery, don't think of large cuts and long recoveries. Think of laparoscopy, robotics, imaging, precision devices, and enhanced recovery pathways. Technology has transformed not just how we operate, but how patients experience surgery. The focus today is not only on cure, but also on preserving dignity, comfort, and quality of life. If you or your loved one is facing GI cancer treatment, I hope this video gives you confidence that surgery today is safer and more advanced than ever before. If you found this video useful, please share it. It may reassure someone preparing for surgery. And don't forget to like, share, and subscribe for more patient-focused education on GI cancer.